So let's start our first class, Fundamentals of Pharmacology. And our goal in this initiative is to introduce you, our students, to the basic principles of pharmacology. What are they? Pharmacokinetics and pharmacodynamics. We're going to use our understanding of basic principles to describe the drug development process. We're going to go through a series of lectures. We'll describe to you what our objectives are to differentiate these principles of pharmacodynamics and pharmacokinetics. So let's talk about what the objectives are for this section of fundamental principles of pharmacokinetics. Upon completion of these sessions, you will be able to 1. Distinguish the difference between pharmacokinetics and pharmacodynamics. You will be in a position to describe the different routes of drug administration. You will be able to define what absorption means and identify the relationship that exists between administration of drugs, absorption of drugs, and the bioavailability of the drugs that have been administered. You will be able to describe what determines how a drug is distributed in the body. In addition, you will be able to identify the primary sites of drug metabolism. You'll be able to describe the purpose of metabolism and the processes that are involved in drug metabolism. You'll be able to describe the determinants of rates of drug metabolism. You'll be able to define the process of drug excretion from the body. In addition, you will be able to identify the relationship between drug metabolism and excretion. You'll be able to describe the concept of steady state concentration and what impacts it. You'll be able to define elimination half-life and the kinetics of drug metabolism. You'll be able to describe the impact of age on all aspects of pharmacokinetics. So let's start. First of all, what is a drug? Well, the most broad definition comes from the Bible of Pharmacology, which is Goodman and Gimmel, and it describes a drug as a chemical entity that affects a living protoplasm. So what then is the difference between a drug and a medicine? A medicine is a type of a drug. It's a chemical entity that's used to treat, cure, prevent, or diagnose disease. So that represents pretty much 50% of what healthcare providers do. So what's pharmacology? Pharmacology is the study of drugs and medicine. It's very broad. It includes evaluating every aspect of medications that we use in clinical practice. It includes the study of the chemistry of the drug, the biology of the drug, biochemistry, physiology, pathology, pathophysiology, molecular biology, enzymology, and genetics. Now, I know for many of you they are terms you've not heard before. We'll help you understand these terms as we progress through the course. But I could simplify it by saying it's every aspect of how a drug interfaces with the human body, what it is about the drug, and how that interplays with normal bodily function. Pharmacology is, in addition to these basic sciences, this study of what is an appropriate target. Why do we swallow a pill to help cure a pain in our fingernail? What is the concept of a relevant target? How do we choose a drug to manipulate that target? What it is that we have to know about the target or the drug to be able to understand the interaction between the two. How do we measure the response the body has after receiving a drug? How do we measure the magnitude of that drug, which we refer to as efficacy? How do we measure the toxicity of the drug in the body's response to receiving that medication? How do we maximize the specificity? How do we make drugs that only target particular parts in the body? And our primary purpose in doing so is an attempt to try and minimize toxicity, the drug affecting parts of the body that we don't want it to do. And then how do we actually prove that a drug works? Who do we have to prove this to, and why do we have to prove it? So pharmacology is a very, very large discipline. It's constantly evolving. It requires multiple different levels of specialty, multiple different disciplines, in order for us to work in concert to come up with medications that improve the health of large populations. And the face of pharmacology is constantly changing. We can take individuals, we can administer drugs, we can measure the response to drugs, both good and bad. We can try and understand how those drugs work. But the specificity of our understanding is ever increasing. For example, we know that environment significantly changes an individual's response to a drug, both in terms of its efficacy as well as its toxicity. We also know that no two humans respond to drugs in the same way. This is the newfound era of personalized medicine. How do we come up with drugs that have a reasonable likelihood of success for individuals? This is the interplay between genetics and drug action. This is an incredibly important field that we will discuss at different points throughout the broad spectrum of pharmacology talks. We know that the interaction between genes and environment is also important. So this concept of giving a drug, how the body responds to the drug, how the toxicity is manifested, how the environment changes that, how the genetic makeup of the individual will determine degrees of response, both good and bad, are all well within the spectrum of the discipline of pharmacology. And in the process of trying to understand all of this, it helps us to have an appreciation of how drugs are developed. Because if we look at this particular slide, you will begin to understand the complexity of the process. So if we start over in the left-hand side, preclinical testing, this is the phase of drug development that can start in a lab, that can start in a chemical library, that looks at ways in which drugs might have a potential effect in an animal before it even gets into humans. This is called the drug discovery phase. It's followed by exposing animals to that particular molecule. And the primary reason for exposing animals to drugs which are ultimately intended for humans is to attempt to determine how the drug might work, if the drug will work, and if the drug is safe. So before that drug ever enters into a human for the first time, we have a reasonable understanding from what are called surrogate animal models how the drug might behave. Before we can actually test drugs on humans, we have to get the permission of regulatory bodies. In the US, that's the FDA. Every blue line on this slide represents direct interaction with the FDA throughout the phase of drug development. The FDA gives permission for the investigators to start testing the drug in humans. There are 3 stages of testing: phase 1, phase 2, and phase 3. These 3 phases are focused on, first of all, trying to define pharmacokinetics, phase 1, pharmacodynamics, phase 2, and then the impact of the drug on clinical outcome. Did the patients get better? Did their disease improve? Was the rate of their disease process slowed down? This is phase 3. At this stage, the drug is still investigational. It has not been approved for use by the FDA. It has to undergo additional review during this phase of time for the FDA to discern whether the drug is safe for use in populations. And then, after the drug is approved, if it's approved, there is a period of post-marketing surveillance which evaluates the impact of the drug, both in terms of safety and efficacy, in broad populations who have been prescribed the drug by healthcare providers. So the purpose of showing you this particular spectrum of how drugs come from being bare molecules in a test tube into how they're used in clinical practice, I hope will underpin the importance of appreciating these basic pharmacology principles that we're going to discuss for the next few slides. So let's think about the magnitude of this discipline. In the US alone, in 2011, there were more than 4 billion prescriptions written. We appreciate that healthcare providers spend more than 50% of their time in treating disease. Drug therapy is used in the vast majority of these clinical scenarios. The primary aim of drug therapy is to prevent, treat, cure, and remember, diagnose disease. In order for this to be achieved, there's a very simple principle. Adequate amounts of a drug must get to the tissues so that the effect of the drug can be achieved while limiting the toxicity. So let's return to the basic principles. What is pharmacokinetics? Very simply stated, it's what the body does to the drug. So let's, for example, think of this. You swallow an aspirin. Your body perceives aspirin to be a non-natural or a foreign substance. It wants to get rid of that drug as rapidly as it can. So the drug, aspirin, is going to undergo a series of steps which are referred to as pharmacokinetics. So to restate, pharmacokinetics is what the body does to the drug. In contrast, pharmacodynamics describes the body's response to a given drug. Did the aspirin prevent a heart attack? Did the aspirin make blood cells less sticky? Did the aspirin improve pain? So in this situation, you could say it somewhat colloquially that pharmacodynamics is what the drug does to the body. It's the response to the body. So in pharmacodynamics, we delve into the principles of drug action. How does the drug bring about a response? So we're going to start off with pharmacokinetics. What are the sorts of things you want to know? What are the principal answers that you are looking for when you are defining the pharmacokinetic profile of any drug that we use in medicine today? Well, first of all, you want to know, how should I give the drug? And you as the consumer want to know, how should I take the drug and why? Then you want to know, okay, so I take 325 milligrams of aspirin. Is it absorbed? Is all of it absorbed? How much is absorbed? Then I want to know, if I'm taking that aspirin for a pain in my pinky, how much of that aspirin actually gets to my finger? Where does the drug actually go? Does it go to places where it doesn't need to be? And if it goes to places where it doesn't need to be, is that the cause for the toxicity associated with that medication? How long does the drug actually stay there? What determines how long the drug actually stays where it goes? And this automatically is going to lead into, how often do I have to give the medication? Then I want to know, how does the drug actually leave the body? This is a critically important question, particularly if you're treating patients with disease. Let's, for example, say kidney disease. Many drugs are excreted by the kidney. So if the patient has kidney disease, is the drug going to hang around in the body longer because of the kidney disease? So we need to understand, how does the drug leave the body? So how do I give the drug? Is it absorbed? How much is absorbed? Where does it go? How long does it stay there? How often do I have to give it? And how does it leave the body? Pharmacodynamics. Remember pharmacodynamics? It's how the body responds to the drug. So what do I want to know here? Does the drug work? So when we develop drugs, when we test drugs in humans for the first time, we're doing it for a reason. We're using drug A to see if it has an effect drug B. We don't willy-nilly give people drugs and then just look to see what the response is. We have an anticipated response that we are looking for. So does the drug actually produce that response? Going back to our example for aspirin, did it reduce pain? Did it reduce heart attack? How well does it work? So is it a case of that low doses work well for something like aspirin, low doses for cardiovascular protection, higher doses for pain management? How well does the drug work? Often this is referred to as dose response. How does it work? Now this is the fascinating part of pharmacology, the mechanism of action. How do drugs actually bring about the responses that we're looking for? And equally importantly, how do drugs bring about the responses that we don't want? And can we manipulate this so we maximize efficacy and we minimize toxicity? Then we want to know, how long do we need to expose the patient to the drug? We always want to use the least amount of medication possible. So is there a definite time period for which the response is needed? And is there a time period that could possibly be shortened? And then, of course, always, where does toxicity fit into the overall picture of efficacy? So we're going to use some more technical terms here. So under pharmacokinetics, everything that I've described in the last two slides can be summarized with these headings: administration, absorption, distribution, metabolism, and excretion. Under pharmacodynamics, we're going to use somewhat more technical terms: dose response, receptor activation as a way to determine mechanism of drug action, both under the headings of efficacy as well as toxicity. Pictures always tell 1,000 words. So let's look at a pictorial overview of the process. What is above the purple or violet shaded area refers to pharmacokinetics. What is below in the violet shaded area is pharmacodynamics. So let's follow the process from the point of actually giving a drug to a patient. A dose of a drug is administered. That drug is then absorbed from the site of administration and gets into the circulation, into the blood supply in here. And we refer to this as systemic circulation. Point to remember, drugs need to get into the systemic circulation to get to their site of intended action. It's the pipe system. It's the way of administering, it's the way of delivering a drug to its intended site of action. And then you want to build up enough drug at that intended site of action in order for it to have an effect. So these three steps: dose administered, concentration, increasing the dose of concentration, are all pharmacokinetic principles. Then once a drug reaches a certain concentration at its site of action, it might be inhibiting an enzyme, it might be blocking a receptor or activating a receptor. What you're looking for then is a response, a pharmacologic response. Let's, for example, switch from aspirin and use a blood pressure pill as an example. The pharmacologic effect of the blood pressure pill is to lower blood pressure. That's intuitive. The clinical response is to see if lowering the blood pressure reduces heart attack, stroke, renal impairment. We also want to know if giving that blood pressure lowering pill causes any unwanted toxicity. Unwanted toxicity is a bit of an oxymoron. Going back to pharmacokinetics, the minute a drug reaches plasma, reaches circulation, it's going to be widely distributed to all of the tissues that it can gain access to. In addition to that, to make things a little bit more complicated, the minute the drug hits circulation, the body is going to want to eliminate it. So as soon as that drug is in plasma, all of the enzymes that are capable of breaking down that drug are going to come into effect, with the attempt being to terminate the action of the drug and enable its excretion from the body. So just to reiterate, pharmacokinetics and pharmacodynamics and the interplay between the two. So let's see how we are doing. A question for you. What is a drug? Your choices are the following. A chemical entity that is used to treat a disease. A chemical entity that is used to treat or cure a disease. A chemical entity that is used to diagnose, treat, or cure a disease. And finally, a chemical entity that is used to diagnose, prevent, treat, or cure a disease. I'll give you a moment, and let's look at the answer. So the answer to what is a drug is a chemical entity that is used to diagnose, prevent, treat, or cure a disease. And I will emphasize diagnose. I think everyone understands that drugs are used to prevent, statins for the treatment of cholesterol, treat, antibiotics, cure, chemotherapeutic drugs used in cancer. However, very often we forget that any substance that is used to help diagnose a disease is also considered a drug. So for any of you that are listening today, think about any imaging study that you have had done in a radiology exam suite that involved giving you a dye. Gadolinium, for example, if you ever had an MRI study. Gadolinium is a drug. So keep in mind that those compounds that are used to diagnose diseases are also considered drugs. Okay, so question number 2 then. Pharmacokinetics describes which one of the following? What the body does to the drug, or what the drug does to the body? And I'll give you a second to try and think that one through. What the body does to the drug, what the drug does to the body. Pharmacokinetics describes what the body does to the drug. Remember, broadly speaking, pharmacokinetics is really the process whereby the body's responding to having something foreign in it and trying to deal with it and eliminating it. And then the last question for this section is pharmacodynamics describes which one of the following? What the body does to the drug, what the drug does to the body. And this at this stage will be easy for you because it's the opposite to pharmacokinetics, and the answer is what the drug does to the body. So we'll take a break here, and then we will move into the next section, which will be administration.